Hi friends, now I have the honor of introducing to you Dr. Hitesh Goel. He is ranked 58 in November 2019 AIIMS. He has been a foundation student with DAMS, followed it up with a test and discussion. And I believe that getting such a good rank in an institute like AIIMS in November is a significant achievement. So Hitesh, how are you feeling today?
Sir, it is a very good feeling to score under 100 in such a prestigious exam, AIIMS. So definitely.
ऐसा लग रहा है कि अभी हमें एक पॉजिटिविटी की फीलिंग आ रही है कि हाँ यार एक काम खत्म हुआ.
Definitely, as soon as the 17th got over, it was totally free. There was PGI exam on 30, but I was not studying much. Only before 5 days before the PGI exam, I started studying again for the PGI exam. So,
you started your preparation with us in the 6th semester in the foundation year.
Yes,
So how was your experience at that time, and how was the feeling of suddenly being exposed to the competitive world? Because it's still second year, many times we are not even thinking about a future exam.
Yes, sir. So I joined DAMS in my 6th semester, January. For the very first class, it was a totally new environment for me after 2.5 years. So when I went for the first class of DAMS, so I decided I won't join because I am not able to sit for 12 hours. But but I motivated myself to be in the competition, to secure a good rank. I need to do this. So from next week, I again tried, and I could do it finally.
No, that's a very good point that you brought up, that when you are from still second year MBBS, second year can be described as the luxury year of MBBS, and suddenly you come to your 6th semester, you start preparing for PG entrance, and that quantum of work that is to be done,
yes, sir, it is a lot.
Yeah, it's a lot. But then if you can motivate yourself, like he rightly said, that he told himself, no, if I have to be on the top bracket, now that he is in a top 100 rank in AIIMS exam. So he, all this started when he motivated himself that, okay, I want to do this, so I'll not give up here. I think that is very important, that thing he did. Because sometimes, I've seen many people, they give up. In different stages of preparation, they give up in between, that I will not be able to do so. But later on, when they get a rank, they realize that they were in that bracket, in that zone.
Yes.
If they had worked a little more harder, they could have actually made it in the zone where you can get the branches of your choice. So what role did the notes that you made in the classes play for your later on revision and your studies?
So those notes were first of all really helpful during my professional examination, as I based my study mostly on those notes now. So during my internship, when I have to revise them, I was already familiar with them. So it was like cakewalk to read those notes. Definitely, some of the notes, especially like ENT, yours notes, Deepthi ma'am's notes, ortho notes, surgery notes, these were really helpful during my preparation. Also, I didn't attend physiology class, but then I borrowed notes. Then physiology notes of DAMS were also very useful during my preparation.
Do you feel those notes are like good enough both for the professional as well as for the PG entrance exams?
Definitely, those notes are really good. They present crisp picture. Definitely, you should not miss out on textbooks during your MBBS examination. But first of all, what I used to do, I used to read those notes and then go to textbook, because notes give you an idea. This is essential to remember. This is essential for your examination. Then you can go on reading textbooks and add whatever you would like in your notes only.
Yeah. Because he's brought up a very important point, that when you're reading a textbook by yourself, you may not know this is important or not, how deep I have to go. Yes. And so when you do it after the class, or when you look at the notes what teachers have taught you, then that gives you the direction.
Yes, sir. Sure, yeah. Definitely.
And I also agree that in today's world, that some element of smart study has to be done. There will be textbooks will be huge. But if you are smart enough to extract, they will be your friend. But if you are not smart, you will actually lose a lot of time.
Yes, sir.
And any particular thing that, when you in internship, you shifted to test and discussion, what was the pattern of test and discussion? Like, you have a test followed by discussion. Like, did that give you some idea on how to apply it in MCQs, or how did it go?
Definitely, like it is essential for one to give tests, because like if you are studying, then you do the back exercise question. There is some element missing which you require during the examination time, that you get only by giving tests, and followed by discussion we get to know what were we missing on how to think, how to apply the concepts. So that comes only by attending test and discussion. So that is how it was useful. Also, test and discussion, like it creates time brackets for you. You have to complete your syllabus by this much time. So also, like if you are not able to complete your syllabus in the stipulated time, so do not carry on that subject after the T&D. Leave it at that point. Move to the other subject, and let it be like हम बाद में कर लेंगे उसे.
It's a very good point that he has brought up, that when you have a T&D schedule, you have to religiously manage that schedule. Like if we are saying that now tomorrow you have a dermatology test, so your course has to be finished by then.
Yes, sir.
Otherwise, if you drag it on, your schedules will go haywire.
Yes, sir. Sure.
Yeah. And any other, like we have those previous papers discussions in video format on the e-Medicos app. Do you feel that this is a good format to use?
It is a very good format. If one is not interested in reading book, or sometimes one is like after lots of study he is not able to read, one can easily watch those videos and quickly go through the previous year question, especially just before the exam, because then there is a lot of burden or sometimes stress, so that those videos helps a lot to curb the stress and bring it down.
And like in exams like AIIMS and PGI Chandigarh, I believe that there is a good amount of topic repeat in the exams.
Yes. Like they won't repeat exactly same question, but mostly, especially I just gave the PGI exam day before yesterday. I just did 1.5 paper before going to exam, but I felt like there were a lot of repeats, not exact repeats, but topic repeats.
Yeah. So now that you've given both AIIMS and PGI exams, can you compare them for a future aspirant? Like when you were giving the PGI exam, what aspects do you feel were being tested which were different from the AIIMS exam?
AIIMS exam is like now becoming more and more practical, clinical oriented. More like you have to keep your eyes and ear open during the wards. They can ask anything, but it will be very simple. It will be in front of your eyes. You miss in general. That kind of things is AIIMS is more focusing more on. But PGI exam is more detailed. They take you to the periphery of a topic, so you need to have a detailed knowledge of that. But no one is that perfect, so need not worry so much. Just have a good understanding of a topic. Go, and no one can attempt those points. So leave them. PGI, I feel कि PGI exam is more about being truthful to yourself and having fidelity towards your knowledge.
Yeah.
So
I think if we put it in one word, like PGI will be more about knowledge and AIIMS will be more about application. Like how you apply it in the exam, PGI you need to know it.
You need to know it, like for sure.
Yeah.
Otherwise there is 100% negative marking.
Yeah. Like, and how was your strategy different during AIIMS and PGI exam? Like how many did you attempt in AIIMS exam and how many did you attempt in PGI exam, considering PGI would have 1250 decision points and AIIMS exam had 288 decision points?
Sir, PGI actually 1250.
1250 decision points. 250 into 5, 1250.
1250.
Yes.
Sir, like PGI exam is lengthy. One should give, first of all, I would like to mention that one should give as many grand tests as possible. One thing I didn't do was did not give grand tests. So my speed was little slow, but somehow I managed to go through all of the question during the time period. That's essential. You should give grand tests. Like AIIMS exam, we have 150 single choice question, then true, false, assertion, reason, extended matching, sequence. So there are a lot of questions. The new pattern questions brings both the things, like you can score more and also lose more. Match the following, extended matching, and also sequence can be tricky. Like they are very easy, but क्योंकि वहाँ पर -1 है, we have to be careful. So like, but in PGI exam it is जितना आता है उतना कर दो, it's sufficient. अगर 1/5 भी मिल रहा है, 1/4 भी मिल रहा है, that's sufficient. Do not take much risks. So
like if I put it in a nutshell, that your approach during PGI was not to take any risks,
yes.
And in AIIMS it was like slightly more aggressive.
Like assertion reason, multiple choice, like वो वाला question, there is 1/4 negative marking in that, and in single correct choice there is 1/3 negative marking, so we can take risks in those questions.
How many did you attempt out of 288?
288 I attempted around 270.
And do you recall out of 1250 names, how many in PGI? 1250.
1250 maybe around 500 to 550.
Okay.
Maybe.
Okay. And how many revisions were you able to do before the AIIMS exam?
It was around one revision only. Like what I have done was during whole of year, whether I was able during some time I was able to study, during some time I was not able to study. What I did was consolidate all of the subjects in one place. So whenever I have to revise, I could revise it in one go. That was my strategy. So I started my revision around 10th of October or 15th of October. So because it was consolidated, because of that only I could revise. So few things I missed also, but it was sufficient enough to get this rank.
Yeah, I think that is the beginning point of any top achiever. Like, they are doing a lot of things, they are attending classes, but they tend to make notes and they tend to put it in one place, so that in the end they're able to do it fast. And any particular topics that you would want a future May AIIMS aspirant that who would be appearing in the May exam not to miss on, like you felt that oh my god, when you were giving the paper, that they are asking so much of this?
One thing new that has come up in AIIMS examination is clinical. Watch all of the clinical videos, clinical test videos, be attentive during the rounds. Procedures you can do, procedure ke steps and all for sequences. Focus more on practical. That is like a coming topic, new topic for AIIMS examination. And also during the AIIMS examination, they tend to ask specific things only. Focus more on previous year, base your study more on the previous year. That will help a lot.
I'd like to add here is that now we have practical videos for surgery, pathology, microbiology already available on the eMedicos app, and medicine is on the way. We'll be uploading it, where we have done all those how to examine the thyroid lump and a lot of things. We've done actual patient encounters we have recorded now, because I feel that that plays a role to complete the preparation. So this is what we have done this year. And Hitesh, I would also like to know that how did you maintain your motivation throughout?
Earlier it was only because of the test and discussion, because that keeps you going. There is a test and you have to prepare, set your target, set your goals. You have to finish. That is an important motivation, actually. Test. I lost my motivation during the July to September period because I had one really hectic posting. But after that I recovered. Whatever I could do, I did. Also seniors play an important role. They keep you motivated. Talk to your seniors, as the seniors who have achieved a good rank. They will guide you, they will motivate you, never let you down.
Any thoughts on the branch that you would want to take now?
Sir, I am considering psychiatry or general surgery. Really.
Let's hope for the best. Let's hope that you get the branch of your choice. Let's hope you make a good decision in the exam. And I'm sure country will have either a great surgeon or a great psychiatrist in you in future.
Thank you, sir.
Any final words of wisdom or any motivating line for the future students? Just a line that would pump them up.
Keep your zeal high, motivation high. It is necessary. Like you can, people are running behind the content. What to read. ऐसा नहीं है. Pick your precise content and consolidate them during whole year. But it is only the motivation that will give you a drive to remember those content and to achieve your goal. So motivation should be high. Talk to your teachers, talk to your friends, talk to your seniors regularly. Stay in touch. Whenever you feel like you are not doing good, do not hesitate to come up to teachers. come up to teachers, talk to your seniors. That is I would recommend. So stay positive, and definitely you can do well during the exam.
And I think the final note is seek positivity wherever you can, is
Yes,
in a
definitely.
nutshell. Like, avoid negative people.
Yes,
And
definitely.
there will be positive senior, positive people, negative. So you have to choose. You can always choose. You can choose your company. You can choose your advices. Stay positive.
Yes, sir. Definitely, because I feel it was only because I believed I can do, like I can secure a good rank. That is why only I was able to make it.
Because if you don't believe, you'll not put that kind of
That much
effort,
effort.
and then the vicious cycle will take you to the negative loop.
Yes, sir.
And that is what the beauty of optimism is. And with that beautiful thought, I would once again like to congratulate you on behalf of the entire DAMS family.
Thank you,
Hitesh,
sir.
heartiest congratulations. God bless you.
Thank you, sir.
Best of luck.
Thanks.